Good day, dear great surgeons. Missed you a lot, and today we're gonna crack the very famous chapter, the orthopedics. How to study orthopedics for the MRCS. If you look carefully to the mark distribution among the exam, you will wonder that the orthopedic chapter is all about the bones and given only 7 questions in the exam, pure 7 questions. But in the exam, this is the most common trick in MRCS. Most of MRCS candidates gone through the exam and went out and said one comment. The paper 2, the second paper of MRCS, is just a trauma and orthopedic exam. Why is that? Because the orthopedic exam or the orthopedic chapter already overlapping with at least 5 chapters. See, 5 pure chapters and other 2 chapters. The congenital chapters with the pediatrics, the trauma chapter, even the oncosurgery, and even the endocrine and the electrolyte imbalance, and the anatomy, as well as preoperative, postoperative, and surgical skills. So almost everything is orthopedic in this exam. How is this? Let's take it one by one. In orthopedics, we will talk about the congenital anomalies, we will talk about the trauma and the fractures, as well as the tumors and the inflammatory process of the bone and the fracture pattern and the preoperative, postoperative, and surgical skill preparation for orthopedics. So, in the congenital anomalies of the orthopedics, we will be overlapping with the pediatric surgery already, and you will find this. You have the pediatric surgery only about 60 to 65 questions. From those 60 to 65 questions, you will find that half of them at least about orthopedics, like the SUFI or Persis disease. This is the congenitals. And regarding the trauma, in the trauma, you will be almost always tricked regarding a polytrauma patient. What is the first to do and what is the definitive management? Just to do the fixation now or only debridement, or what to do? Or what to do with this polytrauma patient? Of course, it's all about the ABC. Never forget it. No matter how many fractures, don't do like the meme or the comics that I had a fracture, I need to fix it, I will be quick. I have done it many times. This is funny. It's a trauma, a polytrauma. You have to follow the ABC very sharp. Never track with how the trauma is disastrous, but be always decisive and organized. ABC, airway, breathing, circulation. And when it comes to the tumors of orthopedics, we have a primary tumors and we have the metastatic tumors. The metastatic tumor from the breast, thyroid, and prostate. So here we come and overlapping with already other chapters affecting the tumors of the orthopedics. When it comes to metastasis to the bone and their management, it will be the same concept, but the same chapter. As well as the primary tumors in the bone. It has a special entity and you have to take care. It's according to the age, according to the size, according to the presentation in the x-ray. So is it a sun ray or onion peeling like? Those signs are important. Then we will get to the inflammatory process in the orthopedics. It's all about the endocrine or the electrolyte imbalance. So take care when he gets a question about the parathyroid especially, or the calcium or the phosphorus or vitamin D, osteomalacia, osteoporosis. It will be all about the inflammatory process and already overlapping with the endocrine and electrolyte imbalance. When it comes to the fracture pattern, here comes the rule to be overlapping with a very famous important chapter. We talked about it a lot, the anatomy. The applied anatomy about the fracture pattern and the suspected bone to be fractured and the mood of the fracture. Is it Smith? Is it Coley? Is it volar? Is it dorsal? It's all about anatomy. You know those fractures already from the anatomy. And here we go in the orthopedics to be revised again. Then orthopedics. It's all about medicine. It's all about surgery. So it, of course, will be overlapping with preoperative, postoperative, and the surgical skills. So take care and get to this chapter and crack it well. Now you know it has congenital, trauma, tumors, inflammatory, fracture pattern, preoperative, postoperative, surgical skills. All of those topics will be within the orthopedic scope. So no wonder the exam might have an orthopedic exam in a surgery exam. Now you are ready because you know those old topics are overlapping with the pediatric chapter, with the body trauma and the trauma chapter in the emergency, with the oncosurgery, with the endocrine electrolyte imbalance, as well as the applied anatomy. Now you can crack all the chapters all together without fear. You are the fear for the exam. Never fear the exam. So happy to have been with you. Until we meet again, be safe. So let's break the orthopedics and never let the bone break you. Together we can with the grace of God.